Hi, my name is Pam Reynolds, and I'm the president of Allegiance Aging Care Services, an agency that provides support to seniors in their homes across Northern Virginia. And today I have John Norris with me of the Medicare portal. I've known John for a good part of a year and have relied heavily on his expertise when it comes to Medicare. So John, just tell us a little bit about the Medicare portal and what you do exactly to help seniors.
Sure. So we are a Medicare specialist. All we do is help seniors learn, understand, enroll, and manage their health care benefits through Medicare, whether it's original Medicare or Medicare Advantage. My job has been a 30-year insurance agent, which is at the core of what's needed to handle Medicare benefits. Mm-hmm. And we work locally in Northern Virginia, D.C., Maryland. So anybody in that area that needs our assistance, we're ready to help.
And to be clear, you don't charge fees for that.
Right, that is correct. We don't charge any fees.
Okay, great. So, John, there's a lot of buzz about the upcoming changes to Medicare. More and more seniors desire to stay and age in place at home rather than moving into support care facilities, long-term care. And a lot of these updates that are being made are to better support that decision and that option for seniors. So I just want to start by kind of listing what some of those changes are for our viewers, and then maybe you can help me dive a bit deeper into a few of them after that. So, okay. So first, the donut hole. This is the coverage gap that troubles so many individuals with high-cost medications each year. So this is closing. It's been closing for several years, and it continues to close through 2020 under Medicare. Next, the cap on therapies, such as physical therapy, occupational speech, that is gone or going away. Third, access to telemedicine is going to be broadened and in some cases actually covered under Medicare Advantage plans. Mm-hmm. Next, home safety devices and some ancillary services to help people in the home, such as home delivered meals, transportation. Those will all have some expanded coverages, also under Medicare Advantage. And then finally, which is of most interest, I think, to our clients, is in-home care, caregiving support services. So our clients, a lot of them have already obviously been using this type of service, and up until now, largely never covered under Medicare or private insurance. So those are just some of the high-level examples of changes that are upcoming. So let's back up a little bit and talk a little more about therapy. So we all know that therapy has a multitude of benefits for seniors, helping them be safer in the home environment. So increasing strength and endurance, reducing falls, reducing pain, and so on. So will this removal of the cap on therapy mean that seniors will have essentially unlimited access, or what?
Yep. So what it's going to do for them really is, the bigger thing is, a lot of seniors experience that they would get therapies and at one point be told, well, your benefit is no longer in existence and you're going to have to start sharing in that cost. And I think seniors are always conscientious of what things cost, and they should be. So having that experience of where they had a limit on their benefit, I think, caught a lot of them by surprise. Now the fact that they can acquire benefits without having to concern about the cost or how many, so they worry about getting better as opposed to worrying about the cost.
Great. That's a huge relief. Okay, so let's talk about the ancillary services a little bit. Things like transportation, home safety devices. These are new options that Medicare Advantage plans can cover and provide these sorts of things. Is that correct?
Yep.
Am I on target
that's
with
correct.
that?
Yep. So what they're trying to look at again is providing care to seniors that is outside just medical, because they understand a doctor can provide care, but how do you get to them? So transportation has become a larger and larger component for all seniors with regard to their health care. Home care, things in meals, recovering from a surgical procedure or a hospital stay is another big benefit. They're advertising it'll be typically 14 meals over the course of 7 days that they'll bring in the home. And then the home modification of things like the safety bars and things like that. That's also, again, a small component, but something that can make a big difference in the quality of someone's life.
So it's better enabling seniors as they're coming home from the hospital or acute care to be set up for success in the home.
100%. 100%.
Okay. Now on to the one I know everyone wants to know more about, the in-home caregiving services. So this is a new coverage for, again, Medicare Advantage plans, so not traditional Medicare. So what is that benefit
Yep,
going
that's
to
great.
look like?
So really it's focused on, they call it the caregiver's benefit. That's the generic term I've been seeing it under. But again, it's going to give them this custodial care, the things that you kind of alluded to. Bathing, dressing, meal preparation, obviously transportation around the home. I think this is a big step for not only allowing seniors to rehabilitate on their own, but to keep them out of going the readmission route too.
So it's sounding like a lot of these updates and changes that are being made are really to the Medicare Advantage arena, not traditional Medicare. So we've talked a little bit about that in the past. I think you've shared with me about 1/3 of Medicare enrollees are on Medicare Advantage plans. So what if someone's thinking about going that route, or just kind of wants to see how that would work for them or try it out? Is there an option for them to do that?
Yep. So under the annual election period, which is October 15th to December 7th, so anytime during that window, a senior can make any changes to their Medicare, including go on Medicare Advantage for the first time. And if that is a person that goes on for the first time, they can actually get what's called OEP starting on January 1st through March 31st, where they can disenroll if they don't like the plan or change from one Medicare Advantage to another Medicare Advantage plan. And then after their first year on Medicare Advantage, if they determine they don't like it in general, they can also disenroll, go back to original Medicare, buy a prescription plan, and then qualify for a Medicare supplement with no underwriting. That's the big key. It's if you go more than 1 year on a Medicare Advantage plan that you put yourself, to go back to original Medicare, that you put yourself in a situation where an insurance company can underwrite you for that supplemental portion. So that's really the world that is, but it's great that they added this OEP to let people give it a try.
Sure, absolutely. A nice test run. Okay, and then just so that our viewers have a little bit better idea in our geography here, what are some of the big players in those Medicare Advantage plans and some of the different benefits they might have?
Yep. So you have United Healthcare, you have Kaiser, you have Aetna, you have Humana, and Anthem in the Northern Virginia marketplace are the largest players, so to say. The programs, again, the companies are able to pick and choose what benefits to add for 2019. So I think you're seeing a myriad within each organization of some offering some or part of others. But you're seeing, you do see somewhat of a boilerplate among Medicare Advantage, because obviously it has to meet or exceed original Medicare benefits.
Right.
So
great. Well, John, thank you so much for this valuable information. If any of our viewers want to reach out to you directly, have a one-to-one consultation, how would they do that?
Yep. So you can go to our website, medicareportal.org, or you can reach us locally at 703-628-7149 is our phone number, or you can email me, john@medicareportal.org.
Wonderful. Well, thanks again, John.
Pam.
I look forward to working with you to help more
course.
seniors in Northern
We'd
Virginia.
love to help.
Thank you.
Yep.